An analogy I often use with patients, say I'm going to gather up a patient, we're going to jump in my car. Well, there happens to be a mosque here in our town. And if we were to drive over to the mosque and knock on the door and someone comes and we're like, "Hi, we're here for you to talk to us about Jesus," we're asking nice people the wrong question. They don't have the frame of reference to answer our question or to understand what we're asking. It's not a disrespectful parallel to draw in that there are certain providers that, though they might identify as women's health providers, but you kind of have to think about where does their expertise really lie. And in my experience in this area where I practice, I can't speak to every women's health provider, but most of them are very traditional in that their focus post-residency is obstetrics and gynecology. So they're going to deliver babies and they're going to operate on women. And I found that those are not the people to go ask questions about these subtle changes that are happening in our bodies. Because in my experience, what I'm seeing happening is if a woman does open up to her OBGYN about some of these problems, they are dismissed. They are written prescriptions for antidepressants or benzodiazepines because maybe they're experiencing anxiety. So, I see a lot of women come in here on Klonopin. I'm like, why are we on Klonopin? Well, I'm not sleeping. Well, do we want to take a benzo every day because we don't sleep, or do we want to figure out why we're not sleeping and then address that reason so that we don't have to use a pretty heavy-hitting pharmaceutical like that on a regular basis?